Let's talk a little bit about dosage forms for just a moment. So, dosage forms could be something like a tablet that is scored or not, a capsule, a troche, which can be, or troche, which can be either broken up or put in along the inside of the cheek or under the tongue. Liquids could either be oral, so you swallow them, or sublingual. Sublingual means it needs to be placed in the under the tongue or in the tissues between the cheek and gum for a while. Yes, especially if it is an oil-based sublingual, it needs to be placed in the buccal cavity for about a minute or so before you swallow it. And the reason why we dispense sublingual troches or dissolvable tablets or sublingual liquids is so that the medication can be absorbed through the tissues under the tongue or in the cheek, and then just sent out to the areas of the body before it goes through the liver. So if you just swallow it, it's going to be absorbed through the stomach lining, and then it will immediately go to the liver, and then it will be dispersed to the rest of the body. So that's the difference there. When we're dealing with topical or transdermal, so as I said earlier, transdermal means that that base will carry the active ingredient across all layers of the skin, past the epidermal, the stratum corneum, the dermal layers into the blood supply. And then the blood supply will send it out to the body. Depending on where it's applied in the body will make a difference as to whether it goes to the liver first or a little bit later. Transdermal can be applied to like the thinner skin of the inner wrist. This is very vascular, or the back of the hand, again, very vascular. Behind the knee, top of the foot, thin skin, not so hairy areas is usually what we recommend. Inner arm, elbow, those are great areas. If you're applying this to a child, the transdermal, we usually recommend a small amount, have it concentrated so you don't have to use a very large amount to rub into the skin. And we usually use the backs of the hands or the inner wrist. And that way we can hold the hand and rub it in at the same time. It's a way to build the relationship rather than break the relationship down.